All right, well, thank you everyone so much for joining us for the Q&A for the Path Forward Strategies to Support Mental Health for Young Adult Parents. My name is Laura. I use she, her pronouns, and I'm a program manager at AMCHP, and I'll be asking our presenters some of the questions that you've submitted via the platform. If you haven't had a chance to ask your questions, please feel free to chat them in the chat box, or if you keep adding them on the questions tab, I'm going to be checking that too, but I'll definitely see them if you chat them in the chat box here. So we're very lucky to be joined by our three presenters. So with that, I will hand it over to Nia, if you want to begin by introducing yourself, and then we'll just go through all the presenters, and then we'll start with the first questions.
Hi, everybody. Thanks so much for joining us. I'm Nia Westbay. I am the Director of Youth Policy at the Center for Law and Social Policy, or CLASP, in DC. Glad to be here.
I can hop in. Hey everyone, I'm Jess Simon. I'm a program manager on the Health Systems Transformation team at AMCHP, and really grateful to Joseph and Nia for partnering on this presentation. And thank you all for tuning in. Joseph?
Hello, everybody. My name is Joseph Yusuf, calling in from Washington, D.C. I'm in a partnership with CLAPS as a change maker.
Wonderful. Well, thank you so much for being here. We're going to jump right on in with our first question, which I am chatting in the chat. I'm a visual person, so I know it can be helpful to read. Someone asked, is there any momentum to reauthorize the Federal Pregnancy Assistance Fund, PAF dollars, that previously funded states to help support expectant and parenting teens and young adults? We found that funding extremely valuable in Michigan and used it to help provide some of the supports that you are mentioning.
Yeah, I can take a crack at this. I don't know if you have insight from CLASP's advocacy work also. And my computer's just freezing a little bit, so I will keep going, but chat me if I get frozen, and I can try again. From what I can tell, there isn't a ton of momentum around it. It seems like when it expired and then COVID hit, it has gotten a little lost in the shuffle. I'm glad that my read on it was that it was the only specific funding for young parents from a federal level. So would love to see something like that again in the future, and can share the article that I'm thinking of that talks about its successes, and would be happy to continue the conversation with the AMCHP government affairs team too, to see if it's something that we are tracking more closely.
Yeah, I don't think I have anything to add. I have not heard anything about this being reauthorized. Unfortunately, there's not a lot of movement on a lot of things in Congress right now. But yeah, no, this is not something I've heard anything about.
Thank you for sharing that answer. The next question that we have in the chat are there suggestions on engaging in support for young parents in a way that complements federally funded teen pregnancy prevention programs?
I can start, and then looks like maybe Jess was going to jump in. I think that's part of the challenge that's named in the report, right? Where sometimes some of the ways that these programs are structured or the funding streams are set up are not necessarily conducive or aligned with young people and their needs, their mental health needs, their ways their families are structured, et cetera. So, and I think that even shows up sometimes in the ways that we name our programs. Not necessarily this program, but I think of WIC is sort of a classic example, women, infants, and children. Why can't WIC be PIC and then, parents, infants, and children? And then we're not inherently excluding anybody, just even in the very name of the program. So I think my, sort of broadly, I think as folks are taking a look at their programs to sort of run it up against some of those criteria that I talked about in terms of, are you inadvertently doing things in the way you have your program set up that are undermining co-parenting? Are we inadvertently doing things in the way we have our program set up that are blaming or shaming young parents, or that are not recognizing that this is a valued identity and role for them? Just sort of going through those questions, you know, in your program, like how does that show up in how we have our spaces set up, in our published materials, our online presence? What does all that stuff look like? So that we can make sure that we're not inadvertently harming or stressing or contributing to young people's mental health challenges in the way that we've designed our programs.
Yeah, Nia, you said it so well. And the only other thing that's coming to mind for me is something you said in the presentation that I thought was so powerful. I wrote it down both times I heard you say it, that when you talk to young people, they're rarely saying, you know, give me more therapy. They're saying, can you stop shooting in my community? So when we're talking about even things like teen pregnancy prevention, are you involving youth in the efforts to tell you what it is they need? Because they probably won't say more education on how not to get pregnant. Maybe they will, but you know, maybe they have community level and social determinant of health factors that your program may just not be thinking of if you're slightly removed from the perspective of the people that you're working with.
Can I jump in with a follow-up question to those points? And thinking about, also, hi, my name is Amani, and I'm the member of AMCHP. I have a question in terms of thinking about the most impactful interventions that you all were just mentioning. There's a lot of national attention on mental health and increasing supports. And for example, one that came to mind is the maternal health hotline that HRSA released. I'm just curious, that resource and others that they're promoting, do you see hotlines in particular as being more or less helpful specifically for young parents? Especially Joseph, just also your lived experience would be great as well, but I'm just curious if hotlines in particular is an intervention that you all are actively promoting or seeing could be useful.
So based off of my experience, hotlines don't exist to me because I need like physical presence. I need people to be in my space to accommodate, to assist, to help me. I try to be the person who would, you know, rely on those type of communications where you can call a hotline and you randomly put in, you know, you're assigned to someone and all that. My experiences were never really productive. So I just learned to, you know, it's kind of crazy because the conversation we have in the Black community is like, you won't go to therapy, but you will talk to someone. You'll talk to someone randomly on social media. So for me, it's like the opposite. Instead of me going to a hotline, I'd rather push for therapy.
Yeah, and I'll just add to that. I think there are challenges with hotlines, as Joseph was just saying, because that's an entry point, but it's not the be all and end all. And so the problem is when you have a hotline set up and there's not the infrastructure behind it for the other types of services and supports that people might need to be connected to when they call that hotline. So, you know, one thing that we've been talking about a lot, and there is a lot of energy around, is the implementation of 988, which is sort of a universal 911 alternative for folks who are experiencing a mental health challenge that is supposed to be live nationwide very soon, in about 60 days, a little less. But the real concern that folks have is that if places don't have their crisis system built out behind that, that when you call 988, folks are going to have a bunch of negative experiences because they don't get connected to the help that they need. And worse, if the crisis system is not built out with an eye towards equity and with an understanding of the unique needs of young people, we're going to end up with what we have now, which is folks of color and young people being disproportionately criminalized because they're experiencing mental health challenges. So there's a lot there that is, like I said, there's energy and excitement and a lot of possibility with the rollout of this sort of national hotline. but also a lot of concern that things are not really ready for that rollout to go well for folks who are the most vulnerable. And there's a lot more work that needs to be done in terms of messaging, in terms of developing the infrastructure, in terms of funding, to make sure that those things work the way that they're intended to work.
Thank you both.
A follow-up question, something that came through during the presentation, kind of related to this. Someone asked, how can we engage with these groups in a virtual or in-person space? So kind of thinking about, you know, everything the past couple of years, transitioning a lot of supports to virtual. Can you speak to what this might look like, what you've thought about, and how you might have adapted the work you're doing?
I would love for Joseph to take that, because the New Deal for Youth initiative I just met Joseph in person for the first time like a couple of weeks ago, y'all, but I feel like I've known him for years. So I would love Joseph to talk a little bit about sort of how we built out New Deal for Youth in the virtual space.
So virtual spaces, 2022, we're still here in virtual spaces. I think when I think about CLAPS and how they engaged us, there was a lot of sessions, and by all means, it varies on a person. As an adult, I learned to just bite the bullet and hush my mouth and, you know, go with the flow of things. For others, you know, make excuses. But for every space, for every Zoom call that we had, 9 times out of 10, there was something fun about it. Whether it was the introduction of having a nice, you know, playlist in the background, or whether it was just having random icebreakers. Like, just it really matters who's in control of the environment. Who are these people that you're bringing in? Because, you know, when you're bringing in people who are the life of the party and can't just sit in silence, then that builds a better community, that builds better engagement. So when I think about those spaces in which, you know, virtual spaces are here and all, I just think what makes it so great and what could, you know, make it more longer, you know, impacting is just including people that engage with us. You know, don't just have somebody that comes and just say, hey, here's a presentation, and like, it's like, no, it's never like that. It's, hey, all right, it's a chance for you to speak. Oh, okay, pop point to this. Well, all right, well, here's a lecture about this. So it's educational, but it's also fun.
Just jump in to add too that I think there are a lot of lessons learned from the past couple of years that we've heard from other youth-led efforts and Title V programs that have been working to stay engaged with youth specifically in the past couple of years in a virtual environment. So I think more and more letting youth lead the way about what that looks like, asking them their preferences, whether it's even like time of day, making sure that you're using the platform that most folks are comfortable with and asking for, can all be really helpful.
Yeah, and I'll add to that from the, you know, from the staff side, we've had to do some things a little differently than a policy advocacy organization normally does. We have New Deal for Youth meetings from 7 to 9 Eastern time. And initially they were on Friday nights early in the pandemic when nobody had anything else to do, right? But that's because we have young people across time zones who are every combination of working in high school and college, parents, everybody has a lot of things going on. So 7 to 9, that's clearly the earliest we can meet for somebody who's in California and getting out of high school. Sorry, I suddenly started echoing. You know, it means that sometimes we have to figure out how, after we've had like a work day, how we're going to bring energy into a call at 7 o'clock at night. I've learned about all kinds of platforms. I had never heard of Discord. I had never heard, I'm on TikTok now, like all these things that I didn't know anything about. But if you're going to be where the young people are, then we, as, you know, the more seasoned individuals, the more mature folks, have to figure out, you know, have to be flexible and comfortable to sort of go to where they are and what they say they need at the times that they say they can do it. And then we just kind of have to roll with it and make it work.
And I have to add to this, like, it is a welcoming space, even though the space is virtual. Like, there had definitely been times when my daughter has came and crashed the scene, and it's like everyone is just like, oh my God, hey. And then there's a conversation back and forth. So there's that.
You were getting some applause in the chat and folks giving you applause reactions to all of your responses to that. So thank you so much for sharing that. So let's see, there's one more question from the audience from the presentation. And then at that point, I very much open it up to everyone on this call right now. For any questions that you have, feel free to chat them in or come off mute. The last question from the chat was, in terms of the study, do you have any that have been done in the Midwest? So can you speak to any similar work happening in the Midwest?
Not from us. As I mentioned, that work that we did was several years old now, and none of that sort of particular set of conversations happened in the Midwest. Yeah, it's been, I don't know if we're thinking about any kind of an update, but, one thing I've sort of started to say to folks is that young people say the same things everywhere. Not to say that there's no nuance based on the specific place that you live, but like we generally get the same things from everybody everywhere. And how many times are we going to make young people say these things before we just do something different? So I would sort of push us to, no, I don't have particular data in this report from the Midwest. We do have change makers that are from the Midwest, but again, we don't have the whole country represented. But just over and over again in so many different settings and so many conversations that I've led, that partners have led, that other organizations have led, it's the same things that are being named. So it's sort of time for us as, again, some of the more seasoned folks in the room to do differently. Because I think this is something I've seen sometimes in our technical assistance work where you get caught up in, you can needs assess a problem to death, but it sort of keeps you from ever getting to the place where you actually do anything different. So I just encourage folks with whatever information is available to you to act, because it's long overdue and young people are calling for it.
Again, you got some applause with that answer too. I think that's resonating with a lot of the folks on the call. One question that I had for you before opening it up to the floor was, you mentioned how folks wanted more communities of care and how that being really critical. I was wondering, are these more like organic communities of care, or are there any models of communities of care or things that you've heard of that are being really effective at addressing this need?
Yeah, I think the folks that we were talking to at the time were talking about the importance of organic communities of care. Sometimes maybe where they had lived in one neighborhood where there was sort of more of that community feel of support, and then moved to another neighborhood where it wasn't there and missing it, right? So I think generally, the way we operate as a culture in this country, it's sort of like it's supposed to be you and your nuclear family, and you're just supposed to do the thing by yourselves, right? Whereas in most places in the world, for most of time, that's not how children were raised. It was in a larger community with support of extended family, of the whole community behind you, et cetera, right? And so I think there's a desire for that type of organic community, but I do think that there are ways to create it when it doesn't happen organically. And I think particularly in sort of two-generation spaces, we hear folks talking about the importance of social capital and sort of, it's not any one particular program, but an important element of programs that support young parents are these opportunities to build connections and to be able to offer mutual support to each other. I think we saw a lot of that in the pandemic with the growth of sort of mutual aid efforts, where it's just sort of folks in the community helping each other. I think there are some examples that I've seen of sort of online communities that do that kind of support. So all that to say, there are ways to build it where it doesn't exist, because it's appreciated when it does exist in a community.
Joseph, if you don't mind me putting you a little on the spot, I'd love if you could share a little bit about the Generation Hope model too, because I think that gets to some of the support piece here.
Gotcha. So for those who are not aware, in the DC or DMV area, there is a nonprofit title or that goes by the name of Generation Hope. And Generation Hope, for me, what I know about it in my experience, so Generation Hope, basically, if you're a parent who wants to further their education, as in college, or I think trade school may be available now, but definitely, community college or four-year college, For the community college, they'll definitely provide you with a scholarship. I think it's up to $1,200 a year. And then for 4 years, $2,400 a year. But it doesn't stop there. And this is why I always say, like, when it comes to Generation Hope, I will always be on speed dial when it comes to volunteering, because for them, the community that they introduced me to, the family that I got to build, the friends, the connections, like, this organization goes above and beyond. Like, every year, during a fall semester, there's a wish list where you basically, say what you and your kid needs for the fall. And a donor will definitely try their best to accommodate your needs. Same thing applies to spring. There are multiple training sessions that take place throughout the year, whereas like workshop, resume workshops, career readiness. There's other ones I just can't think of them because there's just so many of them. But like I said, the opportunities and the resources are just endless. Like, as a person who's, struggles with depression and anxiety and had his attacks and had his low moments, I tell you, like, Generation Hope was there for me. And I keep saying, it's like, I credit Generation Hope 90% of who I am today. If it wasn't for the resources, the connections, the people, I guarantee you I probably wouldn't be in this position to speak to you all or to be in a position that I am in general.
That is so powerful. Thank you for sharing that, Joseph. I feel like that little quote should be like front and center on their website, and thank you for sharing your perspective and your experience. At this point, I'd love to open it up to folks on the call right now. Does anyone have any questions for our amazing speakers? You can either take yourself off of mute to ask, or chat any questions that you have into the chat box.
I don't know if you can hear me. My name is Tricia. Yes.
Yep, we can hear you.
Yeah. And again, I just want to thank all of you, Joseph, and all of you for just being here and just educating us on how we can do more and what works. And as you all were talking about, some just informal things, I thought of something that I did, and I think, it's not something that's so special that anybody else can't do, but there is a couple in my neighborhood, and they had twins recently, and they don't, initially, when I moved here, they didn't speak to me, but I didn't let that bother me. I just thought, you know what? I'm a social worker, and there are 2 babies born, and it's my responsibility whether they talk to me or not. And I let my one of my neighbor, I let her know, hey, we got twins in this cul-de-sac. We need to just kind of welcome them here. And together we went and we bought some things, went to the parents' home, knocked on the door, let them know, hey, we have some gifts for you. We have diapers, and my neighbor, she bought clothing. And you know what, that just opened up this relationship. They invited us in, they just welcomed us with open arms. Because I guess, like you said, in America, everybody's just supposed to be in their little bubble. But you can't be in a little bubble when you have children and you're raising them in this economy and in this world. And it's really opened up a lot of doors. These are individuals who talk to us a lot. They had a crisis not too long ago where I had to be there to help, to just to be with the child and just kind of comfort the children, because one of the mom had a breakdown, because postpartum is serious, it's real. And I was just, I mentioned that because, maybe you are in a neighborhood and you know of someone who just had a child, just do something that you'd want done for you. Get some baby formula, give a gift card if you don't know what to do, but it will mean so much. And when you do that, people tend to want to just kind of open up to you and share, so. Lastly, one of the things I've let them know, I'm like, listen, if things get so hectic where you just feel you're overwhelmed, I'm right here. Leave the kids with me, leave the kids with my neighbor, but don't do anything crazy. We are here for you. And I think that's important. People just need to know they're not alone. So I just wanted to share. Thanks.
Yeah, I love that. Thank you for sharing that experience and seeing support for it in the chat too, you know, being empathetic and compassionate, both as neighbors, and I think even taking it to the next level and at the program level, right? Making sure people's needs are met before trying to reach our other goals, and just at a basic level, being there for people and approaching these kinds of topics and services from a compassionate place will certainly get us further with outcomes we care about.
Absolutely, just a really powerful reminder of just the power of just being a good human and being a good neighbor and being compassionate and proactive in that way. So thank you so much for sharing that. I think we have time for one more question, if there are any other questions from folks in the audience.
What they say, don't go up all at once, right?
If no one has any, I have another question for y'all that I'd love to ask. So you talked about some of the like policy and program like barriers to co-parenting. What are some of the thinking from like of solutions to kind of help address that? What are some of the most important changes that you would want to see made? And are any of those, because you know that a large part of our audience here are state Title V professionals. So are any of those things that are kind of at the state maternal child health level?
I may need some help saying this out loud, but, and I feel like this is a federal thing, but I feel like really if states come together, they can all do the same thing. But I say bring back that child tax credit. That has helped, or it did help when it was, you know, alive. But it's like, come on, man, if we can send billions and millions and millions of dollars to Ukraine for a war that isn't ours, come on. We can put some money into our pockets. We can do better for the families. We can end racism. Like there's so many things we can do with those resources, but yet we just, yeah, I'll let that be.
Yeah, and I think, you know, related, like you said, it's a maternal child health program, right? Like there's some real sort of soul searching we have to do around why we call it that and not a parental child health program, right? Because it's, again, even in the name, it's excluding the Josephs of the world, right? And making him at least assume like that program is not for me. Am I supposed to show up here, you know, with my co-parent? Is this a space where I belong? Like I think you know, words mean something. Words have power, right? And I think there's a lot in the naming of our programs. And again, even some of the rules that we put in place in our programs that sort of pit parents against each other, sort of make assumptions about the parent. And again, nobody's necessarily saying that folks are going to be in a romantic relationship forever. But that doesn't mean that you don't want to parent your children together effectively. And I just feel like, you know, a lot of our programs are stuck in the past when, you know, families have looked different for a long time now. And we really just sort of need a strong audit of our policies and programs and practices to understand how we are sort of perpetuating old ideas of what family looks like in ways that are really harmful to young parents that are trying to support their kids together.
And I want to lift up a really important comment in the chat to this point of how the naming excludes non-binary people and LGBTQ plus parents as well. So I think that's a really important point. So
yeah, hi, this is Cindy Desa. I just had one comment going to what you were just mentioning, Nia, and talking about the policies that we have in place. And as we review our programs, especially if there is any any element of our programs that is patient or client facing, if we're doing any kind of intake, to really lean into the questions that we're asking. You know, we are a maternal and child health program, but are we asking questions that give the ability to explore the family, to understand the context of the family, and make sure that we're honoring everyone as they are in the family. Years ago, I was a social worker at a very large pediatric hospital. And we just really struggled with this. And I'm sure I haven't worked there for a couple of years, but just how we did our intake or our psychosocial assessments, we just really struggled. And we did not honor fathers very well either. If they wanted to be a part, we just didn't carve out a natural space for them to be present if they wanted to. We got really hung up on the legalization around paternity and consent, and who can be present and who can be spoken to and information can be shared with. And it just was so disrespectful. And so I think as we, you know, as a Title V director, we have a program in Virginia that's very similar to the one that was mentioned in the presentation in California. And this is one of my big takeaways from today's session, is to go back and sit and review how are we pulling in anyone who wants to be a part of this family's or of this child's community, of this young mother's community. And I think that's a good space for policy review from that Title V place. I'm actually really excited to have been able to have spent time here this afternoon. It's given me a lot of thought. Thank you. Thank you.
Thank you so much for sharing that, Cindy. Unfortunately, we are about out of time for this Q&A session. I want to make sure folks have a chance for, you know, to get some water, take a break, maybe get outside for a breath before our next workshops, which start at 5 p.m. Eastern, so in about 19 minutes. But I just want everyone on the call to join me in saying a huge thank you to Nia and Joseph and Jess for such a engaging and fantastic conversation. I know made me think and learn a lot, and I can tell it's been the same for folks as well. So thank you all so much for joining us today.